Greg, in your 30th year as the leader of this fantastic institution, you guys are honored once again with the HealthGrade Awards for outstanding patient experience, something awarded to this institution for the 12th year in a row. Never been done by anybody else in the state of Louisiana. Congratulations. What a special award. Talk about that, please.
And it's a great award, and it's a reflection of the staff and the doctors and the patient experience as a result of how care is delivered. And it's also about perceptions and how people perceive the care is given, if it's done with compassion and caring and concern. And the processes, do they work well for people, that is, patients and their families. And it's a lot of things when it's all rolled up and then you get compared to others, it's sort of, it feels great to be a top hospital. And we are trying to, we've always gone after excellence. That's part of our culture. And these are indicators, these are outcomes. So when you can consistently be at the top, we're really pleased with that, because that's more about excellence than going there once in a while.
There's another award, which is one of everybody's favorites. I had to pull this out of a Peyton Manning playbook because it sounds like a football award. It's the Health Catalyst and Flywheel Award for transforming healthcare and improving lives through clinical excellence and advanced wellness center services. And Peyton said to tell you that it's a flywheel to the right and a catalyst to the left, and if he throws it, it's a touchdown.
Yeah.
All kidding aside, another very, very prestigious award.
Thank you. Well, everything's changing, and analytics and artificial intelligence and a number of those kind of things are emerging very quickly and being applied to healthcare. The more progressive hospitals are beginning to adopt those and apply them and getting better results for patients, mostly around quality, some around the patient experience and some around cost. But that was really a great award. I was really proud of our staff. We were in a room full of these great big multi-hospital systems, multi-billion-dollar sophisticated systems out of New York and Philadelphia and Pittsburgh, Minneapolis, Houston, Stanford, California, and so on. We were there in the big crowd, and the guy got up who was in charge of it, and they gave out some awards. And then the guy said that there's one little bit smaller organization here. Our budget is $850 million, but it's not $5-10 billion. And he said, but it outperforms you all.
Yes.
That was a great moment. I wish every one of our staff and our physicians could have been there, and our board too.
When you look at the Wellness Center behind us right now, this is not only a place where people get well, and that's why this Thibodaux Regional has received the award for it, but it's the place to be. People come here just to sit and have coffee if they've worked out already.
Yeah, we wanted that. We wanted to create a place around wellness, where people would come, they'd feel comfortable here, and really anybody. People come in here that have never worked out a day in their life, and we're grateful for that. And then these families come in, and they get a feel of wellness and a taste of it. And so our role in part is how can we help people live, the whole community, I don't mean just Thibodaux, live a healthier, happier life. We have 6,000 members of our fitness here where we're standing.
That's larger than some small cities in Louisiana.
Yeah. We're still doing 350,000 visits just to the fitness center. The third year, will be third year in a couple of months. But we're excited about other things that we're trying to do that and making some headway where we're integrating wellness with clinical care, and that's very innovative in our country. So for patients that have joint replacement, for example, patients who have cancer, and a long list of others, we develop these protocols with our physicians where we bring wellness into it and integrate it. So diet and exercise sounds so simple, but most people don't do it.
This will throw people a little bit, but you're fighting cancer with the novel approach, a hard hat and a shovel, because you just broke ground on an 80,000 square foot new facility. Yeah. Tell us about that.
Yeah, I like the hard hat I have. I don't know if you saw. Mine is a little different than the other one. The brim on it's a really cool brim. Cancer affects so many people. It's tough. But our cancer program we initiated way back in the 90s, recruited the physicians, the staff, built the building, the radiation oncology, the technology, and then the programs and services. And it's grown over the years a lot. We now have 5 medical oncologists. 2 just joined us. We saw more cancer patients last month than we've ever seen. So this center, we hope we spent a lot of time trying to design it so it would create a feeling that's different. When you walk into it, it's a place you feel comfortable, you feel at rest, you feel reassured. It's a clean, well-lighted place, to borrow Ernest Hemingway's comments, and no dark places in it. There's a lot of emotion attached to cancer care for patients and families, and then it flows and it works well. So I think people will find it's a state-of-the-art facility, and then we're doing lots more than that. It's not just a building, it's key physicians and programs and service. You're going to see them keep rolling out.
The only thing that probably has grown equally in size as Thibodaux Regional Medical Center is Nicholls State University and Nicholls Athletics, and I think that's a reflection of your partnership with them.
Nicholls is, I see Nicholls as such an important player in our area in 100 different ways, and so we try to support things from dinners and conferences, and we provide the athletic trainers to all their sporting activities and the young men, young women. And then, like you said, the high schools, and then special events like the lineman camp, Manning Passing Academy, and all of those things. And I think you'll see us do more. We have dietitians now that know how to counsel people, teach. Let's say it's a mom. A lot of moms don't know how to help a son prepare to play football, or a daughter might be playing 2 sports or something. And how you eat affects how you play. People are playing a lot smarter. They're preparing better, and that edge is very important to some people.
Greg Stock, he runs it all. He's the CEO here at Thibodaux Regional Medical Center, and we will be right back with more of our halftime show right after this.